Hello, come in.
Hi, this is Juliet from the nursing department at ECC. I'm here to do basic physical assessment from head to toe. Is now a good time?
Sure.
Okay. I'm going to hand sanitize, but before I start, I'm going to show the camera for validation that the form is only filled out to number 12. Hopefully it can see that. Let's see. Kinda. Okay, so that's filled out. And then we flip the page. And then, so the vitals were already done. I wrote that in. And then up to 12. And then blank, blank, blank. I'm going to show every page. Make sure it's blank. 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 I think that's the last page. Blank. Oh, there's one more. And blank. Okay. I'm going to flip this upside down. I'm only allowed to check it in the middle and then once more at the end. So I'm going to have it flipped upside down so that way I won't see it, but I'm going to put it right here on my clipboard upside down. Okay, so hand sanitized. And I'm going to start the assessment. Okay, so I want to confirm your name and birthday.
Patrick Duncan, 4/9/1985.
Okay. And I'm going to start out with checking your skin and range of motion. So if you can go ahead and put your arms out. Oh, you're one. Okay, let me check your pulses. I don't want to get in the camera view either. Okay, now let me check your skin trigger. Okay. Okay, so start out with your palms going up and then down and then out and then in. And I'm going to do it with some resistance now. So up, down, out, and in. Okay, and I'm going to do the same thing with your arm. Go ahead and go up, down, and then out, up, and down. Okay, but now with some resistance. Up, down, out, up, down. Okay. Might as well just go ahead and do the shoulder shrug too. That's usually later, but go ahead and do it now. Okay, now with resistance. Okay. Since you're doing range of motion, let's go ahead and do your head. So go ahead and look up and go and down. So why did you say ow?
The lights.
Okay, and then look to your right and then to the left. And then go ahead and touch your ears to your shoulders. Okay, now with some resistance. So forward and back. And look to the side.
Sorry.
The other side. And then put your ear to your shoulder. Ear to your shoulder. Okay. Let's see. Oh, I want to look at your nails. The shapes of your nails and your capillary refill. Let me look at your other hand, please. Okay. And your capillary refill. Good. Go ahead and spread your fingers out and then in. And then touch your fingers and your thumbs together. Okay. Good. Do you have any like lesions or itchiness on your head? Okay. I'm going to go ahead and palpate.
Okay.
You need a haircut.
I know. You're going to tell my wife about that.
Since I'm palpating, I'm going to go ahead and palpate your sinuses right now. And check your nose. And then your eyes, your lacrimal glands. Okay. Alright. I'm going to go ahead and... You've not had any leaking or anything with your ears either?
No.
Okay. No pain or anything when I...
No.
Okay. Might as well feel your lymph nodes since I'm in the vicinity. Okay. Now I'm going to go ahead and let's do your nose, mouth, and ears. So I'm going to go put on my gloves to do your nose and mouth. And then I'll do your eyes after. Then I'll have to dim the lights for that. One glove is bigger than the other.
Mm-hmm.
Alright, so I'm going to go ahead and sanitize the otoscope. Always 15 seconds. Alright, I'm going to do your nose first.
Okay.
Go ahead and put your head back a little bit. Okay, look good. And now I'm going to go ahead and do your mouth, but I'm going to get a tongue depressor. Okay. So go ahead and open your mouth. Say ah. No open lesions or anything in your mouth. Oh, you're a little tongue-tied there. Okay. That's good. I'm going to clean it off before I put it in your ear. Seconds. Okay. So go ahead and put your head back just a little bit. No, that way.
Oh,
Yeah.
I see.
Nice and gray and pearly. Do the same thing. Tilt that way. Back a little bit. Looks good. Not much cerumen either. Okay. Take my gloves off and hand sanitize. I'm going to do your eyes. See if they're perla. I'm going to go ahead and dim the lights. Okay. So I want you to look at my nose. You keep looking there. It helps when you don't do that.
I can't. It's way
Okay.
too bright.
And so now I want you to, I guess I can turn the lights on for this part.
I'm blind.
Okay. So I want you to go ahead and when I point over there, I want you to look at the tip of this and then to the door, okay?
Yeah.
Pen, door, pen, door. Okay. Okay, and now I'm going to go ahead and listen to your carotid pulse. I'm going to put it on the smaller diaphragm, bell side. I'm going to feel for it first. take a deep breath. And let it out. Okay. And do it on the other side. Okay. Okay, sounds good. I'm gonna go ahead and unsnap these down a little bit. I'm gonna listen to your breathing sounds here in the front and to the other side.
We have it right on our hands.
What? I'm putting it on the diaphragm side. I'm gonna start on the top. Every time I touch you, take a deep breath, but let it out. Don't hold it in.
Yep.
Okay. I'm gonna go ahead and do your back lung sounds, your posterior.
Mm-hmm.
Okay, can you tilt? No. Can you sit facing this way a little bit? Face this way a little bit. Alright, go ahead and lift this arm up. I'm gonna check the symmetry. Can you turn more that way? There you go. Perfect. Okay. I'm gonna start by listening to your right lower lobe. Sounds good. Okay, so yeah, every time I put the stethoscope on, take a deep breath and let it out again, okay? I'll try and go slow so you don't hyperventilate. Okay, sound good? Now, I'm gonna put my hand right here like a hug. And go ahead and take a deep breath in and out. Okay, that's good. Okay, let me go ahead and cover your cup here.
Can you give me a second? I have to go to the bathroom.
Go ahead and lay down, facing up. And while you're doing that, I'm going to do one of my checks of my sheet to make sure I didn't miss anything so far.
Okay.
And I'm raising the bed up all the way so it's easier for me and so it doesn't hurt my back. I'm gonna hold on 1 second. Ethan, come in here now.
Take the tablet from him.
Give him attention, please.
Stop his screaming now. You stop screaming too.
Okay, now I'm gonna look at the sheet.
Now, Ethan. Okay. Okay. Okay, I'm going to flip that back over. I'm going to do your heart sound. Okay.
So I'm going to unsnap this. Why did you say ow?
Here.
Tie that. Okay, you're good. Okay. I'm going to move the camera view so it's able to see where I'm placing the stethoscope.
Okay.
Try not to bump it too much. Hopefully it can see. Maybe I'll put it here. Yeah, that should be good right there. Hopefully it doesn't move. Isn't this fun? COVID. Okay. All right. So I'm going to start out by finding the angle of Louis. I'm going to start out with my diaphragm, and then I'm going to do it all over again with the bell side.
Okay.
So angle of Louis, and then we're going to the right side. So find the first intercostal, and then go to the second intercostal, and that's the aorta. I'm going to listen to that.
Oh, sorry.
Okay, sounds good. Now I'm going to go straight across to the left side, and this is going to be the pulmonic, and that's the second intercostal space down. Sounds good. And then I'm going to go to the third intercostal space, which is Herb's Point. And then the fourth intercostal, which is the tricuspid. And then the fifth intercostal space, mid-clavicular line. And that's the apex, the apical pulse. And when I use the bell side, I'm going to listen to that for a whole minute. Okay, so I'm going to do all that again, but with the bell side. Angle of Louis. First intercostal, second intercostal, aorta. Okay, and then go across. Pulmonic. And third, Herb's Point. And fourth, tricuspid. And then fifth, mid-clavicular line, apical pulse. And I'm going to go ahead and listen to this for a full minute. 58, 59, 60. Okay. I'm going to go ahead and lift this up this way, and I'm going to do your abdomen area. Make sure the camera can see okay first. Yeah, I gotta move it again. Okay, hopefully this will work. I think there's better. Okay, so we're gonna start with the ileocecal valve.
Okay.
And we're going to auscultate first and then palpate. And I'm going to do it with the diaphragm. Okay. And that's on the right side, kind of by where the appendix is. It's kind of in the same area. And when was the last time you ate or drank anything?
No, yesterday.
You didn't eat or drink anything today?
Oh wait, yeah, I did have lunch.
Okay, when was the last time you had a BM?
3 p.m.
Okay. Definitely hearing some gurgling. Okay, I'm going to go ahead and palpate. I'm going to do it shallow at first, and then I'm going to go a little bit deeper, okay? And let me know if you feel any tenderness or swelling when I do this, okay? No pain or tenderness.
No.
Okay, now I'm gonna do a little bit deeper, okay?
Okay.
Okay. Now I'm gonna move down to your legs. Do a little bit of range of motion. Let me go ahead and see, move the camera yet again. Make sure that everything's in view. Alright. This would probably be a good view here. Okay. So I'm gonna uncover, you know what? I'm gonna check your femoral artery first. Or your pulse, I should say. Okay, good. So I'm gonna uncover this leg. I'm going to ask you to raise this leg all the way up. No, don't bend it. Just
Sorry.
straight up and back down. Okay, now with resistance, up and down. Okay. Go ahead and put your knee all the way to your chest and back down. Now with some resistance. And down. Okay. Now go ahead and bend your knee and plant your foot on the bed. Okay? Yes. Now I'm going to have you put your knee out and then in. Okay, now some resistance. Out and in. Okay. Go ahead and put your foot like about right there. I'm going to check for your popliteal pulse. There it is. Okay. Go ahead. While I'm here, I'm going to go ahead and check your pulses here. Ankle, and then in between here, pedal pulse. Okay. I'm going to do that to the other side, the other leg as well. This might be a little bit challenge. Should have had you in the middle of the bed. Okay. The bed is all the way up, but it's not helping. Okay. Leg all the way up, and then all the way down. And now with some resistance, up and down. Okay. And then knee to your chest and down. Now with some resistance, up and down. Okay. Go ahead and plant your foot on the bed. Now knee out and in. And with some resistance, out and in. Okay. Put your foot a little bit down. Let me get that popliteal pulse. Gotta find that tendon there. It's right underneath. This is one of the hardest pulses to find, but it's there. And if you can't find it by feeling, you gotta get the Doppler. Okay. I'm gonna go ahead and check these pulses as well. Oh yeah, good, nice and strong there. Yeah, pedal. Okay, good. Now I'm gonna do your feet range of motion and check for any edema. No pain or tenderness when I do that?
Nope.
Nope. Okay. Okay, so for your feet, I'm gonna have you do your toes to your nose and then like pressing a gas pedal. Hold on, let me make sure the camera can see that. Yeah, they should be able to. Okay, now I'll do it with some resistance. Okay. Now I'm gonna have you put your feet outward and then inward. Well, just with the ankle. Just do your ankle.
Like that?
I guess, yeah. Now with some resistance. Okay. Oh, let me check your capillary refill.
This little piggy.
Okay, that's good. Now spread your toes apart. Okay, good. And I did your pulses already. So I think we're good there. Now I'm gonna have you sit on the edge of the bed, and I'm going to take cotton balls and place them around your body and see if you can tell me where they're at. So sit up.
Okay.
Let me go ahead and snap that back. Since I was touching your feet, I'm going to do a little hand sanitizing right now. Where did the other tie go?
I don't know.
Oh, way over here. Okay, snap that together. Tie it. Okay. Now, let me go ahead and get those cotton balls. So now you're gonna have your eyes closed, and I'm going to be touching you with cotton balls. You have to tell me where I'm touching you, okay?
Okay.
Let me make sure the camera can see. Just to make sure. Okay. Your eyes are shut? Okay.
Left cheek. Left arm, forearm. Right leg. Left big toe. Right forearm. Right ear. Right leg on the outside.
Okay. Good.
Did I pass?
So far. Okay, now I'm going to have you do a few steps so I can check your gait. Let me move this so you have a little room to walk. Let me lower the bed first before you just get out of bed. I don't want you falling. Okay, I think that's good. Okay, so I'm lowering the bed until your feet touch the ground, okay? All right, now go ahead and stand up. You're good? You don't need assistance? Okay. Now go ahead and take a few steps that way, just normally. Okay, now come back. Okay, now do heel to toe. Do a few steps. You're kind of stumpy doing that.
I haven't done that in a while.
Okay, we'll do it again.
Okay.
Okay. So, I guess bending over that way so the camera can see. Face that way. I'm going to ask you to bend over, and I'm going to feel your shoulders and spine. Bend over. Okay, so they go down. Feeling for your spine, alignment. And it's good. Okay. All right, now go ahead and sit back down. I'm going to do my final check of my sheet to make sure I did everything. And you do have the call light over there in case you need it. It's your phone that's off, but it has a post-it note on it that says call light on it. So just so you're aware. Okay, so I'm gonna do my final check. Make sure I haven't missed anything. There is one more thing I do have to do. Yeah, I did everything except one, and that's hand grasps. So I want you to stick your 2 fingers out on both hands. I'm gonna cross my hands so I know if oh, it's the other way around. No. I grab your fingers, right? No, you grab my fingers. That's what it is. You grab my, and then I feel your. We didn't practice this enough. Okay, so go ahead and squeeze. Okay, and I'm doing 2 fingers because if you do 3 fingers, you're gonna get hurt.
Mm-hmm.
Okay, you can let go now.
Oh, okay.
Yeah, thank you. Okay. So yeah, you have your call light. If you need anything, just let me know. Okay.
Okay. Good night.